Obsessive-compulsive disorder by Brianna D. Ferreira and Joni Proctor. What is obsessive-compulsive disorder? Obsessive-compulsive disorder is a disease that causes the patient to have recurrent and persistent thoughts and impulses that can be very intrusive. For short, you can also reference obsessive-compulsive disorder by just calling it OCD. This disorder causes the patients to experience a number of feelings and thoughts. If we reference the graph in the corner, we can see the cycle starts with obsessive thoughts. This can be about anything, from the patient locking their front door whenever they leave, to dirt, to even the weather. And through these obsessive thoughts, they begin to have anxiety, which leads to the patient to experience compulsive behavior. An example of this would be someone who keeps thinking about their front door and if they locked it correctly. The thought will bring them anxiety, and they may try to constantly and repeatedly open the door and twist the lock to confirm that it is locked correctly. The patient may do this a countless number of times until they finally get that temporary relief and can leave the compulsive thought until the next time they lock the door. And then the cycle starts all over again, from the obsessive thought to the anxiety to the compulsive behavior, and then finally to the temporary relief. Symptoms of this disorder can include patients becoming aggressive. Not only may they become aggressively outwardly towards others, but they can also become aggressive towards themselves. This can cause some patients to experience some suicidal tendencies, though this is only seen in severe cases. People who even suffer from this disorder can often get a fear of dirt, and with this fear of dirt becomes very persistent thoughts about it. Even when they're inside, they may glance outside, and just seeing the grass and the dirt may give them an overwhelming feeling of anxiety. Surprisingly, obsessive-compulsive disorder can actually cause patients who have this disorder to get tics. Some examples of this would be head jerking, shoulder shrugging, or even rapid blinking. Tics can be shown in many more ways than this, but these are just the most commonly found among patients. Adults tend to be able to find their own tics pretty easily and early on in life, whereas children who have this disorder don't tend to realize that these tics are happening or that something different is happening. So it's up to their parents and guardians to try and look out for these tics and to make sure that their children are okay. And if they ever do experience or show any signs of these tics, that they need to go and see a doctor and professional right away. Now, who suffers from OCD? Obsessive-compulsive disorder is a disease that affects more than 2% of the world. In the United States alone, we have nearly 2.2 million people who suffer from this disease. Considering the population of the world is 7.6 billion and 2% are affected, the US's 2.2 million seems like such a small number. We can roughly assume that with that 2%, 152 million people worldwide may suffer from obsessive compulsive disorder. This disorder can be found in anyone. It can be found in adolescents, adults, children, elders, and even be shown in babies. The most common age of the diagnosis is at the age of 19. This seems to be more true towards girls, as compulsive disorder tends to affect females later on. It is commonly found earlier in boys. Like all diseases though, genetics has a huge impact on those who actually do suffer from the disorder. But it is a smaller rate, whereas those who have a family history of the disorder have a much higher chance of getting it themselves. Those who do have a family history of the disorder are at a 50% higher chance of getting the obsessive compulsive disorder themselves, which is an insanely high number. And of those 50%, 30% of these adults begin to show signs of OCD as a child.
What causes OCD? One of the main causes of obsessive compulsive disorder is severe anxiety. Being anxious about certain things causes your brain to think differently, making you act in a specific manner. Some people might be afraid of things, such as walking down a sidewalk and potentially stepping on a crack. They might believe in the old tale of, if you step on a crack, you'll break your mother's back. So they walk a certain way on the sidewalk or road. Some might have to turn the doorknob a few times when opening the door, because in their mind, if they don't, something bad might happen. They feel if they do these compulsive behaviors, it will eliminate the obsessive disorder. Some other causes of OCD could look like someone having to be perfect at everything they do because maybe they're afraid of failure or being imperfect. Others could rearrange everything a certain way because if it's out of line, it'll bother them until they fix it. Sometimes having a parent that suffered from obsessive compulsive disorder, you'll be more likely to acquire this obsession through the DNA strand from the parent. Also, after scientists did research on the brain to find a reason why people suffered from OCD, they found hyperactivity in the subcortical and cortical regions of the brain. But most of the compulsive disorders fall back on childhood trauma or a possible serious traumatic event that occurred in their lives. So their brain blocks it out and replaces it with this obsession. Are there treatments for OCD? Well, of course there is. But for starters, the best type of treatment for OCD would be some type of therapy, also known as the cognitive behavior therapy. Go and talk to somebody. Get to the root of your fears, the causes of your anxiety, and figure out how to overcome these. What can you do to ease your mind from having obsessive compulsions? But sometimes therapy doesn't work for everybody. So the next step would be probably to try different types of medication. also known as serotonin reuptake inhibitors. Some of the types of medication are mainly for depression, but also help address obsessive compulsive symptoms. Doctors, they tend to believe that depression is a lead in OCD. So they fight two disorders with one medication. But some of the antidepressants don't help with the obsessive compulsive disorder symptoms. A couple of the antidepressants known to help OCD alongside depression could be Prozac, Paxil, Zoloft, Lexapro, Luvox, and Celexa. Your prescribing doctor will start you with a dosage that they feel is suitable for your needs, and then they'll go from there to determine the next step. But don't worry, you don't have to take these medications for the rest of your life. Some find that, a 6 to 12-month plan works best for them. By the end of their treatment, they're back to normal and know how to control their disorder. Some might need the medication a little longer, but that's okay. If you need extended time, that does not make you any less than anyone else, because everybody is different. You can also reach out to a hotline that provides you help that your psychiatrist will give you. If you ever need anything immediate, you can always call out for help. Don't be scared. So for the conclusion, when it comes to the obsessive compulsive disorder, there is so much to know, to understand, to learn about it. Most of the people that you run into on the streets, they'll have some strand of OCD, and you wouldn't even know it. Sometimes someone who suffers from OCD, they might need a little bit of help, a little bit of reassurance. You can get treatment and be cured of your compulsions. There's also some interesting facts about OCD that some just might not know. Some famous actors and actresses suffer from OCD, such as Billy Bob Thornton, Nicolas Cage, even our former president Donald Trump, Howard Stern, Jessica Alba, and Charlize Theron.
Just as a recap, obsessive-compulsive disorder can be seen in many different ways. Some people have very mild symptoms, where all they have to worry about is maybe if they locked the door or if they closed their fridge right, or even left the burner on. Whereas the others, who have very severe cases, have these thoughts of suicide or harming others or themselves or harming anything. For the severe cases, it's very important that everyone knows it's okay to reach out and to ask for the help that they need. And for mild cases, where you may only think of jiggling your doorknob, it's easily treated and often only needs therapy or maybe a mild medication. But there's always an option out there to get help. This was obsessive compulsive disorder, and thank you for listening.